The chart summary demonstrates an uncomplicated method to address 3 of the core meaningful use functional requirements. These include having at least one entry as structured data for problems, medications, and allergies for more than 80% of your patients. As we take a look at a patient's chart summary, we see at a glance that there is a list of the patient's active problems, medications, and allergies. Generating and maintaining the clinical list is not a difficult task because with Centricity EMR and Centricity Practice Solution, the process is a simple byproduct of the visit documentation. After examination and testing, GE Healthcare customers can use an electronic superbill to add a problem to the patient's progress note. The problem is not only included in the chart note documentation, but also automatically added as structured data to the patient's active problem list, including the appropriate ICD-9 code. Maintaining and managing a patient's allergy list is just as simple. We can see that this patient already has an entry for his allergy to penicillin. Adding the fact that he sneezes and his eyes water whenever exposed to cats is straightforward. At the same time, the structured information is included in his allergy list. Maintaining the medication list is as simple as writing a prescription. When a prescription or a refill is written, that information automatically updates in the patient's medication list. As we return to the patient's chart summary window, we see that the data entered in the visit note is also included in the problems, medications, and allergies list. It is just as uncomplicated to indicate that the patient has no known problems, medications, or allergies, which is also an element of this requirement. The vital sign template can be useful for capturing height, weight, BP, and calculating body mass index for your patients that are 2 years or older, as outlined in the meaningful use vital sign criteria. Vital signs may be entered manually or electronically through devices. As for calculating a patient's body mass index, sit back and let Centricity EMR do all the mathematics and include it in the patient's chart record. The structured vital signs that have been entered over the course of time can be analyzed by viewing them using Centricity EMR's growth charts. The graphs can be printed and given to the parent, which is in keeping with one of the optional menu requirements. We will discuss patient education materials later in a separate recording. Clinical lab tests ordered by eligible providers can be incorporated into the patient's record automatically using LinkLogic, Centricity EMR, and Centricity Practice Solutions data exchange engine. The results are delivered to the physician's desktop task list for review. Once signed, the lab report becomes a permanent part of the patient's record, accessible at all times. The discrete lab values are stored as structured data. The lab values are available for trend analysis over time by using Centricity EMR or Centricity Practice Solutions flowsheet views. Since the results are stored as structured data, they may be graphed over time. The graphs and flowsheet views may be customized by the clinic. We return to the task list to continue signing labs. Centricity EMR and Centricity Practice Solution provide the perfect balance between the structured data necessary for enhancing the quality of care and population management and the freedom necessary for everyday use of an EMR by clinicians in a busy ambulatory practice. Easy-to-use inquiries and reports in Centricity EMR and Centricity Practice Solution help clinicians maintain better patient health. Generating list of patients by specific conditions does not require a programmer. GE Healthcare users can turn their structured clinical data into powerful information using inquiries and reports. Multi-level inquiries can easily be created and saved on the fly by any clinician or staff member authorized to do so. For example, in just a few steps, Centricity EMR and Centricity Practice Solution customers can generate a list of all male patients diagnosed with liver disease whose last INR was greater than 2.5 and are past due for a PSA test. Once the patients are identified, we can produce a report sorted by selected criteria on the list. Inquiries can be generated using structured data stored in the patient's chart. The criteria could be based upon demographics, medications, problems, allergies, and lab results, or any combination. Media reports indicate an increase in medication errors, resulting in injury or even death, so it is easy to understand why medication reconciliation is a meaningful use requirement. GE Healthcare's e-prescribing partner SureScripts RX Hub enables doctors to view and reconcile medications that a patient filled for periods ranging from 1 month to 2 years. Historical medications for the patient are displayed in the upper grid of the medication history window. They may be compared to those in the current meds in the chart grid found at the bottom of the window. By selecting a medication and using the Add to Current Meds button, Centricity EMR users can quickly add the medication to the patient's active list, including the instructions. Note that the prescribing method is historical.